Today we have a lovely lady who is a patient with severe rheumatoid arthritis, and at the end of the video I will show you some of her x-rays and you can see the difference in what a normal foot looks like versus her foot, and then why she is having so much pain in this one area of her foot. We had talked previously about doing surgery, and we are going to go ahead and get that scheduled, and you'll see exactly what it's for. So I hope that you enjoy the video. All right, so this has been here for a long time. We tried injecting it with Leniva, which was supposed to give it a cushion. Did that work at all?
For about a day.
Okay. So we had talked about going in and fixing this. So let's kind of just trim it down today and get it comfortable, and then we'll talk about going in and removing the prominent piece of bone underneath this that's causing it, and that'll get rid of it, and that'll be nice, huh?
Good.
Yeah. So this looks like a pretty painful. Oh, look at that. It's actually, there's some fluid coming out. It looks like it might be an open sore. So it's been longer since you've been in this time. You said 3 months?
Yeah, I think 3 months.
Okay. So let's see.
Do we need an antibiotic or anything?
No, it isn't infected,
Okay.
but we will need to stay on top of it a little bit closer.
Sure.
But that also tells me that it's a good thing that we're going to do a procedure to get rid of it, because yeah, you can see right here, it's kind of open.
No wonder it it felt worse than normal.
Definitely, because it got too thick, so the skin under the base of it just kind of broke open. All right. So I just want to see something here. So if I put this in, I just want to see how far in it goes. So not that far, but you can see there's like some stuff coming out of it. So we'll treat it with a topical antibiotic until we can get in there and get that piece out. But if it starts to get red or swollen or more painful, or if you start to run a fever, you need to call right away.
All right.
Okay? But until then, this should feel better now that we've got the pressure out.
Okay.
And
should I be doing anything different in terms of washing the bottom of my foot?
no.
Because right now I use one of those puffy things.
Yeah.
And I just rub the bottom of my feet on a soapy.
Yeah, no, that's fine. Just pat it dry really well.
All right.
And then put some topical antibiotic on it, and a Band-Aid.
All right.
For the next few days.
All right.
And then we'll see you back in either next week or the week after, just to make sure it all healed up.
All right.
And then we were talking about taking out the little prominent piece of bone that's under here, so we can go ahead and get that scheduled for you too. So.
Okay.
Well, thank you for letting us do the video of this today.
No problem.
Here we have what a normal foot x-ray straight up and down would look like. And then here we have this patient with severe rheumatoid arthritis, and you can see that nothing really looks the same. Where the arrow is pointing is another area we're going to take care of with surgery. But if you look here, she's already had surgery to take out bunches of those bones. And this is what a pretty normal x-ray looks like from the side. And here's our patient with that big toe bone spur that we're going to take out at the same time we do the surgery to remove this piece of bone. And this is the one that is causing the wound that you see on the bottom of the foot that caused the callus first. And because it's been so long since we trimmed the callus, there's now an open wound there. So this is why routine care is important.